Ladies and gentlemen, welcome back to the InsurTech Summit by CXO Global Forum. We're in day two, and now we've got a presentation on universal health services by Mr. Ahmad.
I'm thankful to give me opportunity to talk on universal health insurance. Yesterday, we have seen many discussions on InsurTech, starting from SCCP chairman and other industry leaders. We saw how insurance is being, penetration is low, but it is increasing, and we need to have technology come in and to play its part in this one. Today, we started with Ma'am Sania Nishtar, the SR's program, the poverty alleviation, and we discuss the poverty alleviation and universal health link. So I will go with the flow of universal health insurance, what is happening right now on this topic, challenges and opportunities, and technological aspects for USC program. So first I take you to this historical universal health insurance. Primarily, this product is actually based on IPD, means only hospitalization is covered, no OPD is covered. Plan is based on secondary and tertiary care basis, only general ward is covered. From the start, the public and private, all hospitals are covered in this scheme. This is the high level structure. The limits are variable in different provinces of Pakistan. The credit goes to KPK government. We started this program as pilot based on BISP score in 2012, 9 years from now. This program was supported technically and financially by a German NGO and a German bank, and 100K life families were covered in this first phase one. On the successful completion of phase one on these families, government of KPK took over this program both financially and technically, and formally launched this for the next 3 years through a tender process. Again, State Life provided the service. Score was the basis, but the number of districts increased from 5 to 10 to 10, 15. And in phase 3 of this program, again, a tender process happened, more population came in, and at this time, more than 50% of the population of the KPK was covered in this landmark program. It ran for 2 years successfully when the federal government, the Prime Minister, asked the KPK government to launch it for 100% population. They got into it. Again, a bidding process was done. The 36 million population of KPK was covered through a process, and it was to run from July last year. With some delay, it was launched by Imran Khan, I think in September in his Swat speech, and then to other districts, other divisions of the KPK, and fully this February or March, it was launched to all the districts, divisions, and full population of KPK. This was a landmark program for PTA government at provincial level. The total benefit as of today for a family based on secondary and tertiary is 1 million. Going next to Punjab, Punjab taken a similar approach, not the same, but with the federal initiative, not by the provincial at that time. In I think 2015, they did a pilot in Faisalabad with 3 to 4 districts and taken it to 36 districts in 2 phases. Based on BIP score again, as at last year, 36 districts are covered, and around 25% of the population, I must say, is now covered for Punjab province. Punjab, you know, is half of Pakistan, 110, 120 million population. Is big. Now, with the change in government in Punjab also, a couple of years back in elections, the federal government, the current Prime Minister also instructed them to take it to 100% population. What they did, they come up with a pilot for this 100%. In a couple of months back, they started from Leia, you know, for 2 divisions of Punjab, that is Sahiwal and DG Khan, 7 districts. And now these 7 districts are 100% covered. So I can safely say that 25% of Punjab population is covered in this scheme. The benefit package is similar, the process is similar, but not same. Package is bit different, limits are a bit different. After Punjab, we have a very small pilot in Sindh and Balochistan. Balochistan, there is a pilot of 2016 on 76,000 families, 4 districts only. Sindh only 1 district at Parker in 2019. And then comes AJK. AJK taken the same approach as Punjab, because the procurement party was SSP federal, so they taken the same approach on the process, on the product, on the execution. So they come across 3 processes, 1 district, 7 districts, and then now currently they are 80 to 85% population of AJK is covered in this scheme. All the sectors, this pilot and full KPK and the Punjab project is being taken care by State Life. Who are the other stakeholders who are running this program? It's Sehat Sulak program, the federal organization, GIZ, a German consultant and NGO, PHMIC, Punjab Health Initiative, and all the health ministries of relevant provinces, and of course, State Life, who is the service provider. So, what is happening now? In KPK, they started with PTI flag, In Punjab, they started with Nawaz Sharif photograph on the health card. They named it different Insaf card. And now, federal government has taken a good step through SSP federal, that the name of the card has been changed to Qawmi Sehat card, to give it a national touch, national health card. So national health card, what will we do? It will go beyond provincial approach, beyond political approach. This is a good approach to from government side, and is being appreciated. On the number side, overall, what is happening today, starting from 5%, 10%, 20%, if I count my country, 45% of population is covered as at today through existing scheme. What existing scheme? We just discussed. Full KPK, 25-26% Punjab, a pilot in Sindh, AJK, and in Balochistan. So, current procurement, the Prime Minister instructed to roll out in Punjab 100% by the end of this year. So, a tender process by Sehat Sulak program is in process, and all this procurement process, I think, will be completed by December, and it will be ready to be executed Jan 2020. It will be a big thing. 110 million, 120 million population of Punjab will be covered. AJK will be fully covered in this program. Gilgit-Baltistan is being added fully 100%. Islamabad as a city has been added as a full. So financial and social impact will be high. What will happen in Sindh and Balochistan? Balochistan, I know from the instruction of Prime Minister again, the government has approved and they will follow the Punjab, and by end of this year or early next year, they will be implementing this program for 100% Sindh. I think there are delays. They have not yet considered it. So going to the practical side of this program, what government admits at different levels, at different platforms where government is involved and the customer is involved, there are 4 major challenges. Financial side, this is high level financial impact. Financial is currently being done. Finances are being provided by provinces from health budget. But the sustainability going forward 3 to 5 years, 5 to 10 years, what will happen? It's a challenge. Human resource, quality of human resource to deal at government level, at insurance level, at hospital level is important. Larger number of manpower will be required in future when it will roll out in Punjab 100% and next in Balochistan, and we will see large numbers. So quality of and trained human resources in this area for government and other organizations will be needed. Geographically, infrastructure is remote. Unavailability hospital, this is a big challenge. This a topic of healthcare, and government is into it. how to take this challenge. And the portability. Portability means a customer living in KPK, how he will get treatment from other provinces. So these are the challenges. Technology, digital transformation, as we have been discussing yesterday, in all areas of a patient service, claim, we need to see how this emerges with the they have done well. Government of Pakistan, the current service provider has done well in a period of 8 to 9 years. They have matured it well, but still we have these challenges and need to see. If I come on some micro level, at patient experience level, service provider level, I can say for a patient, awareness is a problem. Current schemes by the government on awareness were good, but not excellent. Technology can come in here. Enrollment, the registration process based on NADRA, it is good. People are getting engaged. People are getting engaged more and more, but more technology will and should come to facilitate this in future as 100% population is coming and more aware client will come now. Poverty-based program versus universal. This will be we need to see now. They will have, as we yesterday discussed, they will have mobile phone, smartphone, internet. So this should be used. The major crux of this scheme, hospital help desk administration. When patients come at counter, what happens to him? The whole eco culture of admission, then gatekeeping at insurance and then comes to grievance and complaints. This has to be digitized. They have given good start a digital ecosystem there, but this is a basic level. When it will come to 100% population, mean 100%, 80 to 90% hospitals will be involved. So you have to have very robust digital system to cater this need in coming days. At service provider and all marketing awareness area, hospital empanelment area, gatekeeping area, enrollment and integration with NADA, grievance and audit of the scheme will require digital intervention. Other stakeholder hospitals, if my company has 500 panel hospital, maybe only 200 have this HMIS. This is a big area to get data in and then use that data for decision making. At government level, SSP level, the information system and the audit of enrollment, claimant, complaints and all areas to be digitized to get benefit online dashboards. They have done good in technology at government level, but with the 100%, it needs to be enhanced. Some practical tips: use of smart CNIC as health card as it is being done in KPK for 100%. This can be enhanced through NADRA. QR code can be used. High-tech app, they have basic app only, which can show benefit, the limit exhausted and the limit remaining, nearest panel location, referral system, plan procedure, treatment can be planned, and all other operational streamlining can be done through this technology. And where they have 2,000 allowance or burial allowance or other cash allowances, cash claims can be processed through this Jazz Cash, Telenor, Easy Pesa, and via WhatsApp, chatbot, and other AI usages. This can be done. And telehealth is another example. I've seen this child life doing some contacts with big hospitals in Quetta and in Punjab. So this is a pilot. This can be used for good quality health hospital in small cities. Then comes the ICD and CPD codes integration to get this data into and out of for future use smartly. This type of dashboard they are using, showing Punjab 8.5 families, hospital visits, patient visits. This is other than Punjab and KPK, 7.8 families, how many complaints, how many resolved, and what is the satisfaction. This they are doing good, which I refer need to be way forward. For private companies, overall business in coming 2 to 3 years will start impacting the corporate private life insurers. But with what percentage, time will tell. But this will give some future possibilities for private insurer also to top up on basic UH program, maybe on corporate level, individual level for private rooms, enhancement of limits and others, maybe a niche market of OPD. This can come. And then coming to the conclusion of this, our discussion, that micro insurance is coming to universal health insurance. And this we are really talking about data. Yesterday we discussed on penetration. Penetration is low, yes. But if now we see 95 million population of Pakistan currently covered under this scheme, if 5-10% of that them get this year and next year benefit out of that, so they have touched the taste of insurance actually. And we need to, from InsurTech angle, from insurance angle, from life, general, health, all angles, we have awareness partner. UHI is our awareness partner. If their data, 10 million, 15 million got benefit in this year, next year, so they are good prospects. They know insurance, they know insurance benefit, and they know how it works. On the government part, there is no wheel to be reinvented. Partnerships are there. Technology partners should be taken in. Private insurance with health experience. There's hospital empanelment on all areas. They are experienced. They should involve them. Digital health platforms and all such platforms. This is their era of partnerships. Yesterday we discussed. So government at all levels should consider this. That how to leverage this into the. I think this is a program which is going globally in terms of percentage covered, and by the next year it will be, I think, top in the world. When I say as universal health insurance, if we have 150 people covered next year, by next year with this plan of government, it will be a huge program and a good case study for the globe. With this, I take opportunity to introduce my company, Salaam Takaful. We have started in 2006 with Takaful Pakistan. We have growth of 60% last year. Growth in business, products, and technology with focus on technology in all LOEs. Some examples, we have Sandbox recently approved with SCCP on crop cover on parametric basis. We have virtual clinic. We have full application covering motor, health, and other clients. The virtual clinic and health app is fully in-house developed and managed, and is available for all our clients currently. So these are our technical initiatives. Only yesterday we introduced pay as you drive motor product, the first ever in Pakistan. As you drive, you pay for the Takaful contribution and the health cover for communities. We are doing all such initiatives and product digitally and to support InsurTech, and we are on it through technology, inshallah. Thank you. Thank you for your time.